Good to have you with us. You're watching The Big Story with me, Avni Raja. Let's make a start here with the latest developments coming in from the national capital. Now, Delhi Lieutenant Governor has rejected the Delhi government's proposal to lift the existing weekend curfew and end the restrictions on markets. Now, this after Delhi Chief Minister Arvind Kejriwal sent the recommendation to the Lieutenant Governor to end this as a result of declining COVID cases. LG agreed to Delhi government recommendation of allowing 50% attendance in private offices, but added that the decision on the weekend curfew and markets will be taken once the COVID situation improves further. As of now, in Delhi, weekend curfew is from Friday 10 p.m. to Monday 5 a.m. Earlier as well, Delhi Health Minister said that Delhi has gone past the peak of its third wave.
नहीं, ये गलत स्टेप है। एलजी साहब को मान लेना चाहिए था। इससे काफ़ी नुकसान हो रहा है, लोगों के रोजी रोजगार ठप हो रहे हैं। या तो ऑर्डर भी नहीं रखें या वीकेंड कर्फ्यू रखें, दोनों में से एक चीज़ रखनी चाहिए।
वीकेंड कर्फ्यू तो काफ़ी नुकसान हो ही रहा है, बहुत ज़्यादा नुकसान हो रहा है। वीकेंड एक तो आप ऑर्डर रखे हुए, अल्टरनेट दुकान खोलना है, उसमें नुकसान हो रहा है, और प्लस वीकेंड कर्फ्यू भी लगा रहे हैं, तो कोई फ़ायदा तो उससे है नहीं। इसमें तो सरकार को मान लेना चाहिए था।
Weekend curfew is of no use. Like you can see the public here and the markets are open. There's so much rush in the Palika Bazaar, CP. So I don't think a night curfew is also useless. So हटा ही देना चाहिए मेरे हिसाब से। तो
यार मेरे हिसाब से तो सब पॉलिटिक्स है। जब इतनी बड़ी रैलियाँ हो रही है तब कुछ नहीं हो रहा, तो वीकेंड में बंद करने से क्या होगा? आम आदमी को दिक्कत रहेगी। समझे? तो मेरे हिसाब से तो बंद ही कर देना चाहिए।
As we know that today Anil Baijal, our Lieutenant Governor, has stated that till the time the situation gets eased off, and we see that the situation in Delhi is not, the cases might be going down, but the situation is still not under control, and Anil Baijal felt that there is a need for weekend curfew at the same time. As we know that but at the same time, however, the Lieutenant Governor has agreed to the recommendation made by the Aam Aadmi Party and CM that private offices should continue at the rate of 50% capacity. We have certain people out here whom we can ask, and we can know the reactions on how they feel about it.
अरविंद केजरीवाल ने आज लेफ्टिनेंट गवर्नर से बात किया और उन्होंने लेफ्टिनेंट गवर्नर को बताया कि जो वीकेंड कर्फ्यू है उसको हटा देना चाहिए, पर हमारे जो लेफ्टिनेंट गवर्नर है उन्होंने मना कर दिया। वीकेंड कर्फ्यू अभी रहेगा। आपका क्या कहना है इसके ऊपर?
सर, ये अच्छा फैसला है उनका, बट मैं चाहता हूँ नेक्स्ट मंथ खोल दिया जाए। 26 जनवरी भी आ रही है, तो उन्होंने सही फैसला लिया है। अभी कुछ दिन और रहना चाहिए, बाकी फरवरी में फर्स्ट वीक में खोल दें तो बेहतर है।
आपको क्या लगता है सर?
नहीं, कर्फ्यू तो अभी लगना चाहिए। जैसे ये 2 दिन का लगा रहे हैं, ये सैटरडे और संडे का, तो मैं समझता हूँ कम से कम 3 महीना और ये कर्फ्यू रहना चाहिए। 2 दिन का तो कम से कम रहना चाहिए। बाकी अगर पूरे वीकली लग जाएगा तो फिर थोड़ी सी प्रॉब्लम आ जाती है। वैसी प्रॉब्लम में चल रही पब्लिक और प्रॉब्लम हो जाएगी। तो 2 दिन का तो कंटिन्यूसली 3 दिन तक लगना ही चाहिए, बहुत ज़रूरी है। उससे कुछ
What do you feel, sir, on this situation?
देखिए, कर्फ्यू लगना भी ठीक है, क्योंकि अगर लग रहा है कि ओमिक्रॉन बढ़ता जा रहा है तो उसको रोकने के लिए तो यही आपके कर्फ्यू तो लगाना ही पड़ेगा।
All right, let me bring in some expert voices here. Dr. Sanjeev Bagai and Dr. Rajib Dasgupta both are joining me here on the broadcast. Thank you so much, both of you, for speaking to us. Dr. Bagai, let me come to you first. This whole issue as far as the weekend curfew is concerned, you voiced in the past as well that such kind of, curfews are not a good idea. But in this scenario, now the Lieutenant Governor in Delhi has said that we should wait till the situation improves further. What is your own perspective?
Good evening, everyone. So I have said this on many platforms from the very beginning that third year into the pandemic, irrespective and regardless of the variant and the intensity of the variant, a stopgap, superficial band-aid arrangement of either a night curfew or a weekend restriction is scientifically unvalidated. It's something which should not be done. What we really need is to measure the crowds, what we call as crowd control. I would be very happy if Delhi becomes the first state to have a state-wise ventilation policy. It's the most important thing. You know, we are chasing the rabbit in different directions. We need a proper ventilation policy. We need crowd control, and we need rampant testing so that we can isolate early with a judicious mix, like I've said, of lateral RAT with RT-PCR. Being a highly contagious and communicable disease, there would be sufficient amount of spread either during the morning hours and the evening hours, and or both inclusive from Mondays to Fridays. So Saturday, Sunday being off or night being off doesn't make any logical scientific sense. There is also enough data in publications to show that it does not contain or control the spread of infection. I think we need more public awareness. We need a proper mask campaign of an adequate specific size mask. We need proper public awareness of the initial symptoms so that there is no fear, there is no stigma, and so on. So I'm a strong advocate of no night curfew and no weekend lockdowns. What we need is a very, very strong message to the market areas, malls, cinema theaters, and so on, where the crowds come so that it is managed appropriately.
Yes, absolutely. In fact, Dr. Dasgupta, your thoughts on this as well, because very often we see that, you know, the crowd management becomes very difficult for the local administration, and that is why these kind of curfews and restrictions are really imposed. If the crowd management is done, and if that is in some way possible to ensure, do you also believe that these kind of restrictions should be done away with?
Thank you. First, I couldn't agree more with what Dr. Bagai said. This simply has no epidemiological rationale. The epidemiological rationale for physical restrictions, either at the beginning of the pandemic or when we went through the Delta surge, was really to ease the pressure on the health services. This Omicron-led surge is something where we have seen very little hospitalization. No health center or facility has been overwhelmed. Complications and deaths have been low as predicted. And therefore, in short, the health system is simply not under strain. And therefore, physical restrictions or non-pharmaceutical interventions, as we call them in formal terms, simply has no place. As far as ventilation goes, what Dr. Bagai said is absolutely right. However, that's the most difficult thing to implement, particularly because it requires, often it requires engineering, reprofiling of buildings, building bylaws and so on. And therefore, the governments will have to bring in a time horizon to be able to do this systematically. This certainly is an important imperative. And finally, as far as crowd control goes, there is only so much control one can do. The exaggerated response to that simply becomes what's known as securitization, with the police taking over the public health functions. That's not the solution, and therefore that need should be backed by far more nuanced communication, which we still haven't been able to do effectively.
Yes, absolutely, Dr. Dasgupta. In fact, Dr. Bagai, do you think that we are now at a stage where, you know, this whole conversation about being able to live with COVID needs to be had more and more, and protocols and systems need to be put in place for that, rather than, you know, making it larger than life the way it is currently?
Okay, so I think that's the most important question of 2019, 20, 21, and 22, what you have just asked. What now and what forward? So in bullet points is, I think one is we need to remove the fear and the stigma. Stigma of not getting tested, stigma of not letting the symptoms be known, stigma of hiding it from the doctors, or indeed not self-informing as far as home testing is concerned. So I think home testing data has to be accumulated so that we have the exact number. No data means no information. Means the second point important going forward is I very strongly feel that an epidemic going on to a pandemic will become very difficult to become endemic. Each word is carefully thought of, primarily because the nature of the disease in terms of mutational variations is epidemic. So it's going to be a tough one to ask for endemicity. I think we need to get rid of this pandemic, and the only way to do that is through very, very large, wide-scale global vaccination. This is not India-centric, this is global-centric. And last, most importantly, is I think what India needs to learn to live with is two things. One is a lot more discipline as far as society is concerned, and the second is we need to live with a mask. I think there are a lot of societies worldwide which have shown the way forward to use a mask and restrict the spread of communicable and airborne diseases. A classical example is Japan. And having been associated with the community for a very long time in Delhi, they have been using masks since 1990s, and everyone thought why they're using it. And the fact is they've accustomed and adjusted to it remarkably well. So I think masking as a national obligation towards our society and our near and dear ones is extremely important. It's not only from COVID point of view, but it's a host of other airborne diseases, including influenza and indeed bacterial infections like tuberculosis, and making sure that we are more socially responsible. So the bottom line is public awareness, vaccination, masking, and responsibility.
Yes, that's right. In fact, Dr. Dasgupta, I want to, come to you with the same point, because I believe that this is very important now, this conversation to be had about how to now start living with COVID and get rid of that fear, really.
No, we have, I speak, since this discussion is around Delhi, I speak myself as a former public health officer of the Municipal Corporation of Delhi. I have been there in 10 years. I have been through dengue, plague, and SARS. Delhi has a lot of strengths, but it also has a lot of challenges because of the multiplicity of agencies. But in all these epidemics, we have seen and we have demonstrated that these agencies can work together. It's done so in COVID too. And therefore, as a city-state, Delhi will need to have its own plan. And these kind of extremely limited knee-jerk responses with very little or no epidemiological relevance is not really going to serve the purpose. And as Dr. Bagai very rightly put it, how do we live with COVID? And these are certainly not the steps to live with COVID.
Yes, absolutely, Dr. Dasgupta. In fact, those are some extremely valid points at this point in time. I'd like to thank both of you for joining us on this conversation.